So anxiety in this population can be very complex. It can be confusing and really hard to understand sometimes. So today I'm hoping to give you some strategies, some kind of takeaway points that you may be able to use at home, or if you're a provider, maybe apply in that setting. But I think one of the important pieces to know is that sometimes it can be hard to tell if a child really does have anxiety, and some of these strategies can be hard to use in practice, especially when anxiety is really severe or really interfering. So know that these are some strategies, but if you have a child that you're working with or your own child that has really significant anxiety, that you can call and make an appointment with a provider to try to get more help in that area. But hopefully today I can give you an overview on the topic and some strategies. So you can ask questions while I give the talk, but if there's any more specific questions, you can ask at the end about kind of specific scenarios or cases or something like that. So just to get a feel for the audience, how many of you are parents or caregivers for children that have autism? Okay, great. And then how about providers? Okay, is there any other group of people that are here? Okay, great. So we have a good mix of both. So I'll try to kind of cater to both of those areas. So to start, like I said, I'll talk about understanding anxiety in childhood in general. Can everyone hear me okay? Great. And then I'll talk about kind of more specific to autism, some treatment approaches. And then I have a case example that I can try to use to apply some of the things that I talk about. And then I have some resources, some books that I find really helpful at the end of the presentation. So one of the things that's important to understand to start is the idea of anxiety and how anxiety is different from fear. I think that's really important, especially with this population, to try to understand. So fear is a basic human response that we all have, and it comes from years past. Our ancestors really used fear. It was helpful for us to keep us safe. So it's this idea of when there's a threat in our environment, our body responds in such a way to keep us safe. So either to prepare to fight back or to leave that situation. So you might hear people say fight or flight response. And that's important to understand that we all experience that. Children with autism, children without autism, all experience that. But it's separate from anxiety. So anxiety really is some type of apprehension about a situation. So fear is when you're in a situation and you feel really scared and there's something that's threatening to you. And anxiety is when you're in a situation where maybe their threat isn't immediate to you, but you have some worry about what might happen to you, or maybe you're thinking about something scary that's happened in the past. So that's really how these two things are different from each other. And the important thing about that is that anxiety in some ways can help us. So anxiety is there for a reason. We all experience anxiety in our day-to-day life, and in some ways it can be helpful. So can any of you think of ways that anxiety is helpful to either you or someone else? So think about studying for a test. Yeah,
meeting deadlines.
Meeting deadlines, right. So some amount of anxiety is necessary so that you're able to, meet a deadline or study for a test. Another example that sometimes comes up is if you're in a shady neighborhood or something like that, some anxiety is good. It's helpful because it would prepare you for something that could be dangerous to you. So anxiety can be good in some ways, but it can be really interfering for people when it's too high, too much anxiety, or it's always there even when there are things that aren't threatening, or when someone gets really upset and kind of really focused on things that are really unlikely of happening. So an example here is someone that's very anxious about bugs and they're always thinking about bugs, but maybe they live somewhere where it's safe. The chances of them getting really harmed by insects is really small. So this is important to understand because anxiety is a part of life, but it can become impairing. So in thinking about anxiety, with the type of treatment that I use, there's really three main components to understand about anxiety, and this is important for both parents and children to understand as a part of the treatment. So the three components are physical feelings, so there's some type of internal changes that happen when we feel anxious. So it includes things like having sweaty palms or stomach feeling upset, or you get flushed, your face feels red, your heart beats fast, all those physical sensations. And everyone has those types of feelings. Some people might have different feelings. For children that have autism, sometimes I find that they have a difficult time sometimes recognizing those symptoms or reporting that they're feeling that way. The other big important part of anxiety there's usually some type of thought. So the example that I'm using on this slide is a child that's afraid of separation from their parent. So usually there's some type of thought associated with the anxiety, like what if something bad happens to my parent? What if my parent never comes back? For children that have autism, again, it can be a little tricky to understand what are the thoughts that they're having. Sometimes, some children are really good at it, but sometimes they may not be able to report on exactly what it is that they may be thinking. And then there's usually some type of behavior that's associated with the anxiety. So a lot of times that's avoidance, wanting to stay away of the things that you're afraid of. Other times it can be things like behaviors like wanting reassurance, calling your parents over and over and over again because you're afraid that they're not safe or something that's happened to them. And so all of these three components are present with anxiety. And the really important piece is that all of them can be points of intervention because they all influence each other. So if we look here at the thoughts, if a child is separating from their parent and they think, what if mom doesn't come home? They're probably going to feel some anxiety. They might engage in behaviors like clinging to their parents, trying to not separate from their parents, or calling their parents over and over again. And if they think that mom might not come home, chances are they might have some of these physical feelings when they start to feel very anxious. So these three are all really interrelated and they're all important to target for intervention. Another really important part to understand about anxiety is the role of avoidance, because that's a big part of treating anxiety. So when we think about avoidance, what happens for all of us when there's things that make us feel anxious or afraid, when we're in that situation, our anxiety over here gets high. So if you're afraid of heights, when you're in a situation you're on the top of a tall building, your anxiety is going to increase. And what happens is that that's uncomfortable. No one likes to feel anxious, so you want to avoid that situation. So leaving the tall building, getting out of a place if you're afraid of dogs, getting away from the dog. And what happens is that your anxiety is going to go down when you leave that situation. So when you avoid, your anxiety is going to go down. The problem is that the next time you're in that situation, somewhere where you have to go up high or you're around a dog, your anxiety might even be higher. Why might that be? Any thoughts about why?
Because you haven't learned to confront the situation.
Right, you haven't learned to confront the situation, and you didn't learn, the other thing that sometimes happens is that you didn't learn that nothing bad's going to happen in that situation. You didn't stay in the situation long enough. So avoidance works in the short term, you feel better, but in the long term it can be really interfering, especially when you're avoiding things that you need to do in your day-to-day life, like if you have to give a talk in front of other people, or you have to be around a dog because there's dogs when you walk to school. It can be really interfering. So there's a lot of cost to avoidance, and this is something I talk to parents a lot about because it can be really hard. It keeps us anxious, like I talked about. So when you don't face the things you're afraid of, you stay anxious. Another thing that can happen is it can maintain the anxiety, and it can even kind of create certain symptoms. So the example I talked about with the parent and the child's afraid of separating, it can create symptoms like trying to cling to parents or calling the parents over and over, or for kids that are worried about germs, it can create symptoms like washing their hands over and over because they feel really afraid. And then the last part down here is also important. It disrupts effective behavior. So it disrupts learning how to stay calm, learning how to cope when you're in a situation that's scary. Or, it can disrupt learning that you can face things that you're afraid of and nothing bad will happen. The good news is that there's a way to kind of get out of this cycle, and that's through exposure. So what exposure just means is facing the things that you're afraid of and staying in that situation long enough, or facing that situation enough times so that your anxiety goes down on its own. So if you're in a situation that's anxiety provoking to you, your anxiety is going to go up, and then eventually your anxiety is going to come back down. Physiologically, our bodies can't stay at that extremely high level of anxiety for that long of a time. And the more times we're faced with things, the more comfortable we are. The other thing that happens is that there's learning that happens where you learn that nothing bad's happening to you. So you're in this situation that's scary to you, but nothing bad has happened. So exposure is kind of the opposite of that avoidance. So those are all really important pieces to understand about anxiety. Now I'm going to talk about anxiety, what we know about anxiety in typically developing individuals before I get into anxiety and autism. So what we know about anxiety in children is that some anxiety is developmentally appropriate. So what I mean by that is that we expect children to have some level of anxiety just through the normal course of development. So for toddlers, for instance, there's a phase 10 to 18 months where separation anxiety is really common. That's typical. Most kids grow out of it. Around 4 to 6, a lot of kids start to have fears of like the monster under the bed or at nighttime, things happening. That's typical. Their imaginations are developing and they have those fears. Usually they grow out of it. So there's some anxiety that's expected in childhood. However, we know that anxiety can become really problematic for some children. So there's some anxiety that can be really severe and really interfering that some children don't grow out of on their own, and that's when treatment's really important. So it's problematic when it really gets in the way of that child being able to do the things that they need to do at school or at home or going into the community. And it's really problematic when it interferes, what the family's able to do and when the child's really distressed a lot of the time. So those are the instances where we think that it's starting to become less of the typical anxiety and more interfering. In the general population, about 10% of children would meet criteria for an anxiety disorder, meaning the anxiety is really interfering with their day-to-day functioning. And when you look at the research, this is kind of interesting, of children that are untreated for anxiety disorders, it's a little bit mixed. So some children we find do kind of grow out of some of those symptoms, but then there's another percentage of children that don't. So either their anxiety might get worse or it could change. So maybe they were anxious about separating from their parents at first and now they're worried about social interactions, and for some children it can lead to depression as well. So we know for some children it doesn't go away on its own. So there's a couple different groups of anxiety disorders that are studied. So one of them are specific phobias. So some of the most common in childhood are fear of animals or bugs. Dog phobias are pretty common. Blood injection type phobias, so getting shots or having blood drawn. Fear of heights, those are a lot of the most common ones. There's also generalized anxiety disorder, so those are children that are kind of the worriers. They might worry about making mistakes, wanting to be perfect. They might worry about family's finances. Are my parents going to get divorced? They might worry about how things are going at school, getting good grades, and they have trouble controlling those worries. In the middle here, I have a picture. Social anxiety is another one that's more common in adolescence, so worry about others evaluating you and social situations. Obsessive compulsive disorder is another one. I think a lot of people are familiar with people that are worried about germs and then wash their hands. That would be an example of obsessive compulsive disorder. And then separation anxiety disorder is another main group of disorders that are studied. So with what we know about in autism, it's a little bit more limited than what we know about childhood in general. But the literature is really growing in this area because people are realizing it's really important, because anxiety, what we do know is that anxiety is more common in individuals that have autism spectrum disorder than the general child population. So my previous slide said about 10% of kids would meet criteria for an anxiety disorder. And with what we know about anxiety and autism at this point, the estimates are about 40 to 50% of children and adolescents with autism would meet criteria for an anxiety disorder. So anxiety is much higher in autism. A lot of researchers are trying to understand why. Why is anxiety so common? And I'll talk about that in a little bit. But another big piece is how can we address this then? How can we treat this? And that's what I'll talk about some today. And then another piece is how do we assess it? Because it can be really, really tricky with autism, because anxiety isn't always as clear in autism. We see a lot of the same types of specific anxiety disorders in autism, so a lot of the same ones I talked about before, although some of them can look a little different. And then the findings have been a little variable just because anxiety is hard to assess in autism, because it can look a little different. And sometimes children aren't able to report in the same way about what they're feeling, what's going on inside with them, especially if they have language challenges. So what does anxiety look like in autism spectrum disorder? I think this is why I got interested in this topic. I think it's really challenging. It can be really confusing, but I think it is really important to understand if anxiety is a piece of what's going on for a child. So I first got interested in this topic when I was an evaluator for a study that was looking at cognitive behavioral therapy for adolescents that have autism. And I was trying to evaluate the children with their parents in the room and try to assess for specific anxiety disorders. And what I found is that sometimes the symptoms that the kids and the parents were talking about didn't quite fit into what we know about anxiety disorders, but it seemed like there was something there. So some of the things that I noticed were kids or their parents talking about their child just generally seeming upset and distressed about things, but maybe they couldn't really quite say what it was that was upsetting them. Or some kids and their parents would report the kids just shut down at school. I don't know what's going on, but they just shut down at school. They're refusing to do work. I think they might be anxious, I'm not sure. Another thing that some people talked about is their kids were really concerned with kind of having things be a certain way, be it the correct way, and maybe they would erase things over and over again, or they just needed things to be just so. And they'd be really upset about it, and it could really interfere. So I have a case example about that. But I guess one of the questions was, is this part of the autism, kind of wanting things to be just right a certain way, or was it anxiety? Another thing that I heard some teenagers and parents talk about were kids that maybe used to like to socially interact, maybe they liked being around other kids, but as they got to the adolescence, maybe they were bullied some, or they had some negative interactions, and then they started avoiding interacting, and maybe they didn't want to go to clubs or groups that they were a part of before. So was that anxiety, or was that just part of their social difficulties, part of the autism? It was hard to say. Meltdowns, getting really upset in certain situations, and tantruming or yelling and crying. Hard to say for some parents whether they thought their child was anxious, or getting really silly and dysregulated in certain situations, laughing uncontrollably. That was another thing I heard talked about a lot that's not necessarily talked about a lot in the anxiety literature. Another thing that came up sometimes was anxiety about access to restricted interests. So I have Minecraft up here because that's a topic that came up a lot with some of the kids I worked with, but kids that would wake up from the moment they woke up, do I get to play Minecraft today? And they would really worry about whether or not they'd be able to engage in their interest. And then anxiety about rejection. And some of these teenagers were being rejected. So was that kind of reality-based, or were they really anxious? And that was even contributing even more, maybe, to not wanting to be around other people. And then some of the topics that I saw come up were a little different than some of the other topics that I talked about before. So anxiety about access to restricted interests was one that came up, so being able to do the things they liked. Anxiety about certain routines. So the first child that I worked with that had autism anxiety had a lot of anxiety about the menu. They needed to know the full menu for every meal at the beginning of the week, and they would think about it over and over and over again and really tantrum when there were any changes to that menu, and it was really interfering for the family. Schedule, so any anxiety about changes to the schedule and the routine and how things normally go. Again, it's hard to say with this, is it part of the autism or is it anxiety? Another one that I noticed is I have an elevator up here. That's one that I've seen pretty commonly. But some of the anxiety then turned into an interest. So for some of the kids, I noticed that they were anxious about, say, elevators, but they were also really interested in elevators, and they would look at pictures of elevators over and over or watch the elevators, but it also made them nervous. So that was a little different. Weather is another one that came up. And so with that one, it was less about the weather sometimes, but more about like the not knowing. I don't like not knowing what's going to happen. sensory sensitivities came up some, so loud noises or fear of fire alarms. Sensory sensitivity is a part of the autism spectrum disorder diagnosis now, but it was also something that came up that was related to phobia, so feared response and with that stimuli. And then some unusual things that kids were afraid of. So one child was afraid of the color yellow. I worked with another child that was afraid of the word happy and really just stressed and worried about seeing things that had that color or had that word. So these are just some of the examples of things that I was seeing clinically at that time that there wasn't a lot of information about. And now we have a little bit more information about anxiety and autism and how it can be similar in some ways to what we know about anxiety disorders in childhood, but also in some ways different in important ways. So there's some literature now about atypical anxiety in autism. And so what that literature has really tried to understand is what are some of the unique ways that anxiety can look like in this population. And so there are really 4 groups of atypical anxiety that have been identified in this population. So one of them is anxiety around routine, novelty, and restricted interest. So I'll give you a couple examples of that. So with this, it's kind of, you can maybe see related to some of the things that we know about autism. So liking things to be the same way, not liking new things, having certain interests. But this could be things like, one of the examples that's given in the literature are children that like to always go the same route, maybe to go to school or go somewhere else, and they maybe have anxiety as soon as they get in the car, are we going to be able to go the way that I want to go? Or anxiety about changes to routine, so that was one of the things that I talked about before. Or the restricted interest one, maybe anxiety about having access to the things that they like to do, whether it be Pokemon or Minecraft or some other activity. So that was identified as kind of an identifiable group of anxiety in this population. And then there was another group of unusual specific fears. So some of them were fears of specific kind of sensory experiences, so specific noises. So baby crying is one that was identified as being kind of common. Some other ones were specific jingles or songs on the radio. Another one that was identified was balloons. So a lot of the specific fears had some type of sensory element to them, but they weren't necessarily common types of phobias. Social fearfulness was another group that was identified. So with this is kids that are afraid in social situations, but maybe they're not afraid of being evaluated by other people. It's just something about being around a lot of other people that's upsetting to them. And then the last group that was identified are compulsive or ritualistic behaviors. So things like having the doors angled in a certain way, all the computers off, just things that need to be a certain way. Do you have a question?
So the social fearfulness, is it just being around a group of people or a group of people you know?
It could be either with that example. So it really could be either. It was specifically added because for social anxiety and typically developing children, there has to be that element of other people are going to evaluate me in some ways. And some children with autism, it was thought maybe didn't have that fear that other people would evaluate them, or maybe they couldn't express that, but just being around people, whether it be a small group or a large group, is distressing to them in some way. So I think it can be either. Which is, I think it's important to note which type it is, because it might give you more understanding about what could be upsetting about that situation for the child. So I want to talk just briefly about some of the correlates that have been studied. So we don't quite understand why yet anxiety is so common in autism, but people are really trying to understand why, because it's important to understand so that we can try to intervene earlier for some of these kids, because it can be really impairing. Some of the areas that have been studied so far are looking at child-specific variables. So age and gender are some of the variables that people have looked at. So we find that as children get older, higher rates of anxiety, which makes sense. It kind of follows the trend of what we see with typically developing children. Anxiety tends to emerge later in school age into adolescence, and we're seeing the same thing in autism. As far as gender goes, some research has shown that it's, even though autism is more prevalent in males than females, females on average in some of the studies have had higher levels of anxiety than males. Other correlates that have been found are IQ. So this has been a little bit mixed, but some studies have found that children that have higher IQ report more anxiety. but I don't think this has to be the case clinically. I've seen children with a range of IQ that have anxiety. One thought is maybe they're able to report on their anxiety a little better with higher IQ. Another thought is that maybe children that have higher IQ might have more insight into, I have difficulties, other people know I'm different, and that could lead to anxiety. Autism-related challenges have also been looked at as correlates. So for children that have more severe impairments, some research has shown that they may have more anxiety. And I have another slide that I'll talk about that in a minute. Family history is another correlate. So we know in the typically developing literature that anxiety tends to run in families. And we see that in autism as well as one component. Neurobiological differences have been another hot area that people are trying to understand. So ranging from sensory differences in autism to just how their brain works, how it processes information, connectivity in the brain. We don't well understand that yet, kind of what the mechanism is, but there's thought that that is underlying anxiety. And then there has been some research looking at temperament, meaning certain characteristics of individuals that are present from an early age. So one of the topics that I've been interested in is this concept of intolerance of uncertainty. So this has been studied a lot in the anxiety literature, and really what it is people vary in how much they like change, how much they can tolerate change. And with kids that have autism, you see that they have higher levels of intolerance of uncertainty. They don't like change a lot. And so researchers have been trying now to explore some of these characteristics so that we can try to understand why anxiety is so common, but we don't fully understand it yet. So one of the areas I've been interested in is social anxiety in autism. Particularly, this comes into play a lot of times in adolescence or adulthood. And do any of you recognize this fellow? Yeah, so this is John Elder Robinson, and he is a big autism advocate. He's written a number of different books. Look Me in the Eye, I think, is his most popular book. But this is a quote that he said that I think really struck me, and I think talks about kind of the experience of social anxiety and autism. So he says, I can't look at a stranger's face and think, she's smiling just like Amy. When Amy smiles like that, she's happy, so this person is probably happy too. Instead, I watch and evaluate with a slightly anxious feeling. It's as if I have to build a behavior database for every single person I meet in life. When I encounter someone for the first time, the slate is blank and I don't know what to expect. So I think that quote kind of speaks to, for many individuals with autism, the natural anxiety that they feel when they're interacting with other people, because many times they don't know what to expect when they interact with other people. They have more difficulty understanding other people's perspectives and their emotions, and that for many people can lead to anxiety. So it kind of speaks to this relationship between, autism severity, social difficulties, and social anxiety. So if you have more social difficulties and you know that, you might naturally be more socially anxious. And then the more anxious you are, the more difficulties you can have when interacting with people. So it can kind of feedback in this loop. Another thing that I've seen is that experiences of social difficulties such as bullying or victimization can lead to social anxiety as well. So now I'm going to transition to assessment. So things to consider when trying to understand anxiety in this population and whether behaviors you're seeing are anxiety or something different. So before I kind of go through this, I think one of the things is that this is difficult to assess sometimes, so I'm just going to give some general considerations and pointers, but oftentimes it's pretty complex, and so I recommend that if you have questions about a specific child, to seek an evaluation or a treatment to try to better understand. So one of the factors to consider, one of the things that I consider when I'm trying to assess whether a child with a diagnosis of autism has anxiety, is whether or not the symptom, whatever they're presenting with, is a change in their functioning. So you would expect with anxiety that it wouldn't be something that the child was just born with and has been present forever. With anxiety, I would expect that there was some change in how the child was doing. That's one of the ways that I try to disentangle whether it's a part of the autism or maybe it's something new and different. So For an example, if we're thinking about social anxiety, one of the things I might think about is, did the child always avoid interacting with other people? Or were they once kind of interested and then they started to notice they were different or something happened and then they started to get anxious and then avoid it? So I think that's one of the really important things to think about is this a change in how the child was doing, or is this just kind of how they've always been? Another thing to think about are the specific behaviors that you're seeing. So I talked about, typically developing children might talk about worries, things that they're afraid of, or they might talk about what their body feels like. But with some children with autism, it's really hard for them to recognize what it feels like for them or to report what their thoughts are. So some of the things that you might look for in autism could be a little different. So I have this list up here that I'll talk about, but please know that these symptoms, don't have to be anxiety. They could be something else. But in some cases, it is indicative that the child's anxious. So some of the things that you might see are things like clinging, so wanting to be near the parent, not wanting to separate, avoiding or refusing to do things, so that could be a big sign that there's something distressing about a situation. Crying or change in the child's facial expression could be indicators. Being irritable in certain situations could be an indicator. Having tantrums or aggressive behavior. So sometimes we think about those behaviors as just being disruptive or trying to get out of something, but for some children that are not able to communicate what's going on for them, that's kind of how it's coming through, is being aggressive or tantruming when they are anxious about something. Sometimes there's self-injurious behaviors that children engage in when they're really anxious about something. Another area to think about with autism that I think people don't always think about is that sometimes there can be increased repetitive behaviors that you see with children that have autism when they're anxious. So that could be for children that have like restricted, really focused interests. They may talk more about that interest when they're really anxious, or become more fixated on that interest when they're really anxious. Or for children that have some repetitive behaviors, whether it be hand flapping or spinning or something like that. Maybe they'll engage in those behaviors more when they're anxious. Skin picking can be something that's seen when children are anxious. Or perseveration, kind of focusing on a certain thought and just thinking about it over and over and over again. So again, these are some of the behaviors that you might look for. It could mean that there's some anxiety, but we really have to carefully look at it to understand if it does. Somatic symptoms are another thing to look at. So that just means physical symptoms that a child's having. So some of the things to assess for are sleep difficulty, so difficulty falling asleep or staying asleep or being excessively sleepy. Sleep difficulties are really common in autism for a lot of children. So with this one, you might look at if there's a change in the child's sleep. That could be indicative of anxiety or they're worrying at nighttime. Other things are headaches, stomach aches, muscle tension. Those all could be indicative that the child's really anxious or tense and worried. GI symptoms can also be another indicator. So some of these could be indicators, but again, a lot of these things are also common in autism, so it's important to assess if it's a change in the child. And then another piece to assess if you're trying to understand whether it's anxiety or part of the autism are kind of the overlapping pieces. So one overlapping piece would be the avoidance piece. So with autism, many children may avoid social interaction or have difficulty with social interaction. And so you want to assess, is it because they're anxious or is it kind of a part of the autism? Also, you'd want to assess if it's just a repetitive behavior, something they like to do, versus something that they're doing because they're anxious. And then is it rigidity, difficulty with transitions, or is it that they're anxious about it? So you really have to try to see kind of what side, and it can be really hard to do. Another thing to consider is a child's self-report ability. So I've talked a little bit about some of the challenges that some people with autism have about reporting on what it feels like for them, thoughts that they're having, but some children with autism really can report on some of these things. And I think it's worth trying to see if the child can identify what are things that make you nervous, what does being nervous mean, how does it feel in your body, and I'll talk about some of the strategies for that. And then another important thing to think about are antecedents and consequences. So I'll kind of walk you through that. But what are things that precipitate the anxiety? So when does the anxiety happen? Certain time of day in certain environments. And also what happens after the child has whatever anxious behavior. Do they get to avoid something? Do they get access to something they want? Those are all really important things to think about to try to understand what the behavior means. So in talking about some of the environmental factors, I think this is really important to try to understand, because for children that have autism, there could be environmental influences that are leading them to feel anxious that can easily be modified. So some of the things to think about are things in the classroom. So a lot of children have anxiety at school. Maybe they're in a classroom that is overwhelming to them. There's a lot of children in their class, or they're in a classroom where the rate of learning, kind of what's being delivered to them, or the language levels above their abilities. And so one of the things to consider is if there's been a change in the classroom or the level of support they have at school. That's important to think about. So it's natural that a child would feel anxious or frustrated or overwhelmed if they're not getting the support they need at school. So that's a really big piece to look at if a child's having anxiety at school. Another thing to think about are increasing academic demands. So if a child, was functioning okay at school, and then maybe they proceed to the next grade and things are getting harder for them, maybe that's contributing to some of the anxiety. Experiences of bullying. So this is something that's we know is pretty common in autism, unfortunately. And if a child's being bullied, it's understandable that they are experiencing anxiety, don't want to go to school, and these things can all be addressed kind of externally to from the child. If there's other psychiatric problems, so something like ADHD could lead to anxiety. So if the child's having trouble focusing and they're forgetting to turn things in, or they're making a lot of mistakes, that can lead them to feel anxious. So we want to make sure it's not something else that's going on. Or illness. So some children, may have internal symptoms that they're having trouble reporting on, and it can lead to some of the behaviors I talked about before, tantrums or aggression. And so all of these things are really important to consider when we're thinking about if it's anxiety or not, because we can intervene in these areas. And in some cases, if the anxiety is reality-based, I'm in a classroom that's too hard, I don't have enough support, we can kind of alter the environment, and then the anxiety may be reduced on its own. So all things worth considering. What we would recommend in these cases are altering the environment and then seeing how the child responds. Do they still have anxiety even after we give them the support they need, or we address the ADHD? Are they still anxious? So one of the ways that I talked about to kind of get more information and assess for anxiety is through a functional behavioral assessment. So this is looking at what happens before the behavior and what happens after the behavior. And I'll do an example of one of these assessments with you with a case example. But things to look for about the environment are kind of important. So where does it happen? Does it happen at home? Does it happen at school, in the afternoon, time of day, that type of information? What are things going on in the environment, the antecedent? So is it when they're in gym class and they're overstimulated, things are really loud? What does the behavior look like? So some of the things that I described before, are they tantruming? Are they talking about their restricted interest? Are they trying to run away? And then the consequence. So what happens after the child engages in those behaviors? Do they leave the classroom? Do they get attention? Do they get something they want? Okay, so I'll transition to talk about treatment, and then we'll come back to that. So there has been efforts to develop treatment specifically to target anxiety and autism. So the way that this has been done is by modifying some of the treatments that have been used in the typically developing literature with children, for children that have autism, in ways that makes the material more accessible to children with autism. The interventions that have been modified have been developed for children that are about 8 upwards. And typically they've been developed for children that have an IQ of 70 or 80 or higher. That being said, some of the strategies that are part of this intervention can be modified for children that are younger or have more language problems or lower IQ. And it has a number of different components to the treatment. So parent education and training is a really, really important part of this treatment, or any treatment with children that have autism, helping parents to understand their child's anxiety and how to react to the anxiety and how to encourage their child. And then psychoeducation is another important part. So that's kind of the things I talked about at the beginning of the talk, explaining to children about the different feelings that they might be having, explaining anxiety, talking about different types of thoughts that they might be having and what to do with those thoughts. And then talking about anxiety and exposure. So why do we need to face the things that we're afraid of? Kind of explaining that to the children. And all of this really needs to be done in a way that is developmentally appropriate to the child at the child's level. And then another big piece of the treatment is developing coping strategies. Another big piece is exposure, so I talked about before with anxiety. The thing that maintains the anxiety is avoiding, so we have to help children gradually face the things that they're afraid of. And then homework practice is another big part of the treatment. So typically the treatment's like a weekly therapy appointment, and then outside of session, a lot of the important work happens where the parent's helping the child in their environment face things they're afraid of and practice coping. So parent education is a big part. Teaching parents how to structure the environment to set the child up to be successful is a part of it. Helping parents to understand anxiety, so all those things I talked about at the beginning. How to respond when their child's anxious, and how to coach the kids. So how to coach them to practice self-regulation, how to practice facing things they're afraid of. So I think this slide's worth kind of talking about. Parenting a child with ASD and anxiety can be really challenging, because one of the things that we know about, parenting a child with autism is many times children with autism need more support than their typically developing peers need. But at the same time, with the anxiety piece, we know that they have to be facing these things that they're afraid of. So balancing the two can be really tricky. And so there's the literature, this is from the Facing Your Fears intervention, talks about kind of how to do that, how to balance those two things in an effective way. And so on the left here, it talks about adaptive protection. So this really talks about structuring the environment so the child can be more successful. And then once you structure and support the child, gradually having them face things that they're afraid of. And so that's kind of the goal, kind of what to strive for. But I think sometimes what can happen with children that have autism and anxiety is that I think it's a parent's natural inclination to want to help and to protect their child, and there's so many things probably that are hard for your child to do. And so, with excessive protection, what can happen, and this happens for many children that have anxiety, is the child feels anxious and they want to avoid things, and then the parent allows the child to avoid the things they're afraid of, because it's hard to see your child anxious, and also it's hard for the family to function in many cases. If the child's anxious in different situations, so the child gets to avoid the situation. But what happens is the child doesn't get to practice coping skills when they avoid. And then the cycle can kind of continue, and for some families get out of control where they're avoiding more and more and more things. And so it's just, I think, important to kind of understand the two sides of this. So one of the pieces I talked about is structuring the environment. So I won't spend much time on this, but these are kind of the typical autism-specific strategies that a lot of people talk about, ways to set up the environment for the child to be successful. Using things like social stories. So Carol Gray, has this book of social stories, basically ways to explain things to children with autism about why we do certain things, why we keep our hands to ourselves, or why we sometimes have fire drills at school, or kind of anything like that you'd want to explain. Using visual schedules, so setting the environment so it's really predictable and the child knows what's going to happen. Giving warnings if there's changes to routines. If children have difficulty with transitions, using timers or warnings for that. Those things are important to be in place so the child's set up for success before starting something like an exposure. And then with psychoeducation, these are kind of the parts that we want the child to understand. We want them to understand anxiety, have a name that they can use for the anxiety, and understand kind of these different components of anxiety. So in teaching children about what anxiety is, I think it's really important that it's appropriate to their developmental level and fun. Some children don't want to say they have anxiety or don't want to say that they feel scared, and so I think one of the ways to introduce this topic is to make it fun. So doing a word search, depending on the child's interest and their level, for emotion words, or watching movies. So this is Inside Out, a really good movie about different emotions, or watching TV shows, anything that can pull the child's interest in, you know, so if they have a favorite TV show, trying to label different emotions in that show, just introducing the topic and building their understanding and their emotion vocabulary is a really good place to start. Another piece is helping children to understand what it feels like in their body when they feel anxious. Many children, this is really hard, and maybe they don't notice what happens in their body, or they go from 0 to 60 and there's nowhere in between. And so I think this is a really important piece. So one of the ways that this can be done is there's a lot of if you just Google cognitive behavioral therapy online, there's a lot of great worksheets people have already made for some of this stuff. And that's where I pulled a lot of this from. But having the child, if they like to color, kind of color in where they feel in their body. So this is an example a child did when they start to feel upset. So a lot of times it's helpful for children with autism for you to give them examples of these are the things that people sometimes feel. Where do you feel it in your body? So they could either draw it or they could cut out and put it on the body. And I think this is important so they understand what it feels like in their body. And the parents know what it feels like, so you can prompt them and let them know when it's happening. Measuring anxiety is another piece. So having children understand that there's different levels of anxiety. So you may feel calm some of the time, and then some of the time you get really upset, but there's also some of the time where you're in between. So many children using visual aids is helpful with doing this. So here's some examples that I pulled from online. This is from the incredible 5-point scale book that they have, but it's a scale that can be used from 1, so this is when the child's very calm, to 5 when they've lost control. And you can identify the different things that make them feel this way. You can pull in interests. I think this is a Minecraft one that someone did to help them understand what level they're at. And this can take a lot of practice too. Creating a name for anxiety, I also think, can be helpful. So this comes from the Facing Your Fears intervention. These are worry bugs that kids created with Play-Doh, but it's a fun way to introduce the topic of worry to children and to externalize it from them. So you're a person and you have worry, but the worry is also separate from you, and it's something that we're going to try to fight. And so one of the ways to do that is to create a worry bug and create a name for that bug, and then you can use that bug to talk about what's going on for the child. Say something like, I think this is your worry bug right now. I think you're really worried. And they can pick the name for it. Thoughts, anxious thoughts, is a component of treatment. For some children that works, and other children it doesn't work as well. Some children really respond to this, others don't, and I think it can be an important part, but it doesn't have to be. So one of the ways this is sometimes done is by giving children examples of other kids, things that other kids are afraid of and what they think. So here's an example of a snake and what the child's thinking about the snake, like it's going to kill me. Oh no, maybe it will kill my mom. And this is fun for a lot of kids because that's not going to happen. And well, what could they tell themselves that's more helpful for for this example? And oftentimes this is easier for them to do than their own fears. But it's a starting place to introduce the idea that we have thoughts, and some of the thoughts aren't helpful. And what thoughts could we say that are helpful? Teaching self-regulation is another area, so understanding kind of what's going on with their body, what anxiety is, what are the thoughts, but also self-regulation. What I'll say about this is I think this is important to do when children are calm to start off. Learning these strategies, learning how to relax when they're calm before you try to do it when they're upset. So these are just some of the strategies that can be used, and I put different ones on this slide because these can be used with children with different ages, different levels of functioning. So some of these on this slide are about breathing, so taking deep breaths and teaching children, ways to teach children how to do that. So this is a simple kind of visual depiction of how to do that. So smell the flower, blow out the candle. So a way to teach a child how to take a deep breath would be imagining smelling the flower, then blowing out the candle. For even younger children, a strategy that sometimes uses blowing bubbles. It kind of forces you to take a deep breath and blow out. Here's a kind of visual depiction of taking 5 deep breaths and checking them off. One of the things that I've used that helps some children take deep breaths is having a visualization, so like a ball that they can pull as they take the breath and then breathe out. Other strategies that can be used are making your body feel like a wet noodle, so teaching them to kind of make their body really relaxed. I think that some of the strategies that occupational therapists use, some sensory strategies, can be helpful for a lot of kids to teach them to use when they get upset. Other strategies can be related to having like calming thoughts. So some kids like to think about their interests, what it is that makes them happy, whether it be Pokemon or Minecraft or whatever other interests they may have, creating a poster board about it or just having happy thoughts about it. And then exposure is another really important part, as I talked about. So I don't think that we're going to have time to go through the case example that I had, but I do want to talk about exposure, and then maybe we can stop and you can ask questions. So with exposure, this is the part of the treatment where you're teaching your child to face the things that they're afraid of in a gradual way. It's important for it to be structured, so you're not just like throwing your child in the situation that's really anxiety provoking for them. I think a lot of times the question is where to start. So maybe a child has a lot of different fears, some things they're really afraid of. Well, how do we get started with them facing things that they're afraid of? I think the best place to start is where the child's ready. So sometimes what I've done in treatment is start with something the child maybe is just a little bit afraid of, so that they can kind of get the hang of it and understand what this is all about before going to something that might be really upsetting to them. So an example would be, I worked with a child that didn't really like balloons. He was a little nervous around balloons, and we started with that. So just looking at pictures of balloons, looking at a deflated balloon, bringing in a real balloon, and then he kind of got it and he felt good about it. We really praised him, and then we moved to things he was more afraid of. So sometimes starting where the child's ready is the best way to get started. Or if they're not quite ready, just starting with a low or medium level fear is the best way to start. And you build up as the child gets more comfortable. So some of the strategies for parents that I recommend are, once you have a sense of what you want to help your child face, review the fear that they're going to face, and practice strategies before the exposure. So the strategies that you're using to help the child relax and help the child cope before they face the thing that they're afraid of. Oftentimes I'll use a little cue card of what can you tell yourself when you're afraid, what can we do to help you relax, kind of get it set up for them. Provide encouragement, but never push a child to face something they're not ready to face. So we really want you to do this. I know you can face your fear, and really encourage them, but never force them to do something they're not ready to do. Being positive and supportive. So really encouraging them, like, I know you can do this. This is important. We're going to face your fear, and then you can have more fun. And ignoring a lot of excessive kind of displays of fear. So being positive about when they face the fear, but if they're clinging and crying, not responding to those behaviors as much. Really giving the attention for facing the fear. For the exposures, I think it's really helpful to do it for a certain amount of time. So if it's being in the dark, let's start with 10 seconds or something like that. Or we're going to stay in this situation for this long, or until your anxiety goes down, instead of just like throwing them in and we'll see what happens. So really setting it up beforehand. And then assessing how anxious the child is as they're in the exposure is important too. You don't want to end the exposure if they're still really nervous. You might maybe need to back down if they're still really nervous. But if they leave the situation and they're still really nervous, we haven't really successfully done the exposure. And you want to end with success. So if they're really anxious and it's not working out, you might back down to something a little easier the child can face so they feel positive. So I'm going to skip through these and just end with kind of incorporating rewards. So praising that brave behavior, practicing the coping strategies when they're calm, reinforcing just practicing the strategies, using a sticker or tracking chart to keep track of the behaviors you want. And you can also decide upon specific rewards for practice, so things that the children might earn by practicing facing their fears. So if you practice 5 times this week, you'll get to play on your iPad on Sunday, something like that. So things that the children are earning as rewards for doing these things. So I'm going to skip ahead a bunch and just end with some of the resources. So on the very last slides of the PowerPoint, I have some of the resources that are available about anxiety and autism and treating anxiety. So some of the resources I talked about were from the Facing Your Fears intervention, which was designed for children that have autism. Unstuck and on Target is another intervention that uses similar types of strategies. The 5-point scale I have here. And then these are some more general kind of anxiety-related books that have been written that I think are well written for parents. And then there's some children's books that have been written on this topic, so explaining to children about worry and fear. So I'll end there, I think, with these resources. And maybe we can turn the camera off for any questions.